members of the technical committee, members of the press, ladies and gentlemen, good morning. It is a great pleasure for me to make a statement in this workshop. About a year ago, the process of establishing a national social health insurance scheme began. It is a presidential concept authorizing the Ministry of Labor and Social Security to supervise its establishment activities, with NACIT providing the technical know-how. This is purported to boost up its agenda for prosperity. The successful completion of this scheme will also help to save lives of vulnerable Sierra Leoneans who may find it difficult to access affordable health services in the country.
The scheme covers 35 primary healthcare diseases, including senior citizens over retirement age 60. 95% of all national healthcare services will also be covered. According to the National Coordinator, Dr. Joseph Kamara, the National Social Security and Insurance Trust (NACIT) have been providing technical leadership as well as coordinating the entire process leading to the establishment of the Sierra Leone Social Health Insurance Scheme (SLESHI) or Bodi Osusu, developed and presented to Cabinet at a pre-Cabin OPED meeting. He maintained that there is need for a reliable and sustainable domestic financing model to achieve universal coverage in an efficient and equitable way. Health insurance has emerged as the preferred financing option to extend access to health care in countries where health expenditures are high.
You must have a medical arrangement between you and your employer. And in most cases, what normally happens is the employer will shoulder the responsibility for the employee. And so what we are saying here is, probably take for instance, the total medical bill per person is, let's say, 3 million a year. So what we are looking at is, you go to the wage bill, the basic, it's just 6% of that. So at the end of the day, it's not like you will really contribute something from your salary. No, it's a matter of just reducing the wage bill. What will be set aside? So on that note, primary healthcare diseases, what we'll do, I guess everybody here has registered, your emails are down there. We'll try to send to you again this presentation and the list of the potential primary healthcare diseases we are looking at.
He noted that many activities have been undertaken and that key among those are the willingness to pay survey to determine informal sector, households' willingness to participate in the proposed health insurance scheme, including the inception, actuarial valuation to determine the premium for members and financial soundness and the equilibrium period of the scheme.
What's the role of the private sector? What would be the role of the banks, the insurance companies, the mobile companies, in ensuring we have an effective and efficient health insurance scheme? Then the board composition. How many people do you think should be on the board? And where should they come from?
Sierra Leone's present health system is not sustainable because of the high out-of-pocket payments for health care, adding that people in the informal sector and the indigents are mostly poor and they have to finance their medical bills by borrowing from family members before accessing quality and affordable health care, opined Dr. Kamara. The Minister of Labor and Social Security, Dr. Matthew Timbo, recalled that in April of 2016, President Ernest Bai Koroma called on the Ministry of Labor and Social Security to work with NACIT to coordinate the process of providing affordable health through the Social Health Insurance Scheme. During the Roundtable Dialogue Forum, 3 policy guide areas on revenue generation and collection were key among other issues of concern. Before the Ebola outbreak in the country in 2014, Sierra Leone's total health expenditure per capita was $224 in 2014, which is 61.3% and mostly on medicines and consultations. Private financed 78%, including external assistance. Public financed was also rated high. consolidated revenue spending, according to the National Coordinator Slashy, Dr. Joseph Kamara, has decreased from $4 to a little over $1, adding that Sierra Leone is still over-reliant on external funding for health. This report was compiled by Abdul Rahman Kamara and read in the studio by Eric Silas Kawa.